I do operate the Wisconsin Injury and Sport Laboratory at UW-Madison. And in my research lab, we really have two different research lines. One that's focused on injury risk factor identification, so trying to figure out what predisposes people for injury and kids for injury and how we can prevent those from occurring. And then the second one, we really focus on the anterior cruciate ligament, and so we focus on after people have surgery, how can we then optimize rehabilitation, and then how can we make sure to mitigate the injury risk or re-injury risk after people have an ACL injury. I am not here to try to kill sports either, right? I think that playing sports is absolutely wonderful. I think playing sports is a great way to maintain physical activity across your lifespan. One couple things that we know about playing sports, right? The more physically active you are as a kid, the more physically active you're going to be as an adult. And the more physically active you are across your lifespan, then that means the less likely it is that you're going to develop diseases associated with physical inactivity, right? So for example, tons of cancers like breast cancer, right? Cardiovascular disease, dementia, so on and so forth. So if we can keep people healthy throughout the lifespan, then that's what we really want to do. The problem is that injury and musculoskeletal injury is one of the biggest reasons why people stop being physically active and quit sports and stop playing sports. And so if we can intervene in that somehow in some way, then I think that's a good thing. The thing I really want to talk about today, though, and kind of do my 20-minute spiel on here, is related to youth and sports specialization. University of Wisconsin, in the past couple of years, we've developed quite a reputation for our research on sports specialization. So there's no true or totally agreed upon definition, but the general idea with sports specialization is that it's playing one sport year-round, right, at the exclusion of other sports. So we have specialization and we have professionalization. So kids these days are doing more and more. We're building bigger and stronger athletes, right? And do we really have the design to hold those muscles and bones together? And also specialization, right? So for a variety of factors, kids are basically being asked to quit multiple sports to focus on one sport, right? And the idea being that the more you do this, the more you focus and you play one sport, in theory, this kind of leads to a neuromuscular imbalance, right? So if you're going to do soccer types activities over and over again, then you're going to overdevelop musculature associated with soccer, underdevelop other musculature, and does that then make you at risk of injury? We don't know about that yet, but we do know that, and we have some pretty good evidence from our lab that shows that specialization is related to injury. We really want people and parents and real kids to have at least 3 to 4 months off per year. They don't have to be consecutive, right? So for example, you could play football, make sure you try to get a month off, right? Then play basketball, try to get a month off. Then play baseball in the spring, and then try to take another month off. We know that sometimes that's not realistic, especially sometimes in smaller communities, right? So the second recommendation is something we call hours per week related to your age. So that basically says that kids who are playing sports should play about the number of sport hours per week of organized sports related to their age. So if we have that 13-year-old soccer player, right, she should be playing about 13 hours per week of organized soccer and or strength training, for example, that are directly related to soccer. And if she went up to 16 or 17 in an off week, I wouldn't be too worried about that. But the problem is, when you talk to our pediatricians, they have kids that are playing 30 hours during the school year, and they're playing 40 during the summer, right? Because now they have unlimited time to actually participate. If I was going to do kind of a take-home point for you guys here, it's, making sure that if you're the parent or you're a coach, I think one of the big breakdown in communication is between club sports and school sports. And there's a big disconnect between what the clubs do and what parents do and what kids actually are doing. And so, there's this big communication breakdown, and and unfortunately, a lot of this does fall on the parents because the parents are kind of the ultimate arbiters here of their child's schedule, right? And so they might need to say, maybe we need to take a little break here from this particular practice in order to make sure that you're doing things safely.
Can you define that idea of what it means for time off for a kid who is a multi-sport athlete?
So yeah, that's a fantastic question. I think what we're talking about here, for example, is we don't want people to be couch potatoes, right? So we don't want them to just sit there and do absolutely nothing. We don't have great guidelines, but I think kind of active rest would be good. Cross training would be okay, but I think a good way to think of this is like, if you're trying to give information to someone, I think you want, if you were playing sports, right? High days can be high days, and that's perfectly okay. Like low days should be low days, not low days and then heading to another sport to do something else days, right? And off days really should be off days. What age would you want a child to specialize if you had to choose? So the answer is it depends, but as long as possible. If they're a freshman in high school and they're starting to specialize, that's okay. Ideally 15 to 16 would be ideal, but a lot of the ships, it depends on the sport too, right? If you have a gymnast and you think that they have a chance at making the elite level, well, they have to specialize a lot earlier, right? Other sports, for example, like long distance running, you don't even need to specialize until you're way into high school. If you go back and you look at the New York City Marathon and what age the finishers are, they're all like 28, 29, 35-year-old folks. So it really depends on the sport, right? There's some sports where early specialization is probably actually needed if you have a chance. But again, most people don't have a chance, but who am I to quash the dreams of a 12-year-old girl, right? Or a 14-year-old boy. But yeah, if you're a longer distance runner, then you can wait a long time before you actually specialize in that sport. You're not going to peak, you're not going to be really good until a lot later anyway.
Do you recommend any type of extra equipment that athletes can wear?
Yeah, so braces, for example, ankle braces work great to prevent ankle sprains and ankle injuries. Work from one of my colleagues, Tim McWine. He did a great study, again, in high school Wisconsinites that basically showed that ankle braces are really effective at preventing injuries. If you're a football player and you wear knee braces, that research is, again, very, very mixed. It's not clear that there's a benefit from wearing from knee braces, especially like linemen, right? We see this even in our Badger athletes about preventing injuries. You can cherry pick some studies, but overall, it's really unclear whether there's a benefit there or not. Compression garments, there was a study that just came out on compression garments and showed that didn't really have any effect on the athlete's performance whatsoever.